It at times gets to be very sad that patients will say they're in their own home, I want to go home. Older patients are asking for their mother, who's deceased. They don't recognize family members, they're with their spouse and they say, who are you? It gets to be very, difficult for the family members and the caregivers. Patients are usually brought in by family members. And the typical story that we get is months. So maybe the past 6 months to a year, family's been noticing a decline in mental function, which prompts them to come in. Patients themselves tend not to be aware of their disease. Few of them are able to understand what's going on and able to come in on their own, but most people come in by family members. In terms of the physical exam, the biggest thing is going to be the mental status, memory testing, cognitives. We have different things that we use, clock drawing testing, mini mental status exam, counting backwards by 7, recall. So what I use, some people use what's called a mini mental status. I use Montreal Cognitive Assessment, which is a little bit different. Research is out there. Earlier diagnosis is better, but the available treatments that we have right now only delay the progression of dementia. So what I like to tell people is, in their pre-dementia or their, forgetfulness stages, that, dietary modifications and healthy living habits are the best thing to do. Well, it's a degeneration, so it's a neurodegenerative process, so there is loss of brain. There's predominantly loss of acetylcholine receptor neurons, a gradual deterioration. So, looking what do they think what goes on first, a lot of times when patients have degeneration of the brain, they lose the sense of smell. The brain degenerates, the brain shrinks, and we can see different changes along there. I hear one doctor describe it very well, that these patients are projected in different, so they put themselves in different, states or different time zones, that at one time they think they're 20-year-old, or, their mind is set that, they're back in time, and this is what's going on, and that's, you always want to try to keep your mind as active. You don't want patients to be withdrawn in front of the TV, and so you want to continue their interaction, either interaction with other people, playing cards, going out with friends, going out with the mall, being with family members. We always recommend doing things like crossword puzzles or word searches or things like that, just things to keep yourself active.